Hello viewers, I'm Ron Grant coming to you live and direct from Tortola in the beautiful British Virgin Islands. Thank you so much for your time. Pain is something that affects each and every one of us, particularly here in the Virgin Islands. We have a number of persons who suffer in silence truly from immense pain. Dr. Stephanie G. Vanterpool is a targeted pain treatment specialist who has been providing specialized pain management services here in the BVI at the Bougainvillea Clinic since March of 2021. She is a proud BVI lander and the daughter of Dr. Hesketh Vanterpool and Mrs. Jean Vanterpool. Now, Dr. Vanterpool is a board certified in both anesthesiology and pain medicine. She earned her medical degree from Duke University School of Medicine, later returning to Duke to complete her MBA. She completed postgraduate training in anesthesiology at the University of North Carolina, Chapel Hill, and her pain medicine fellowship training at Wake Forest University. Now she has over 12 years of experience practicing pain management in the USA. Since 2016, she has served as the Director of Comprehensive Pain Services at the University of Tennessee Medical Center and Assistant Professor of Anesthesiology at UT Graduate School of Medicine and the Medical Director at University Center for Pain Management of Knoxville. Dr. Vanterpool is recognized regionally and nationally as a thought leader in pain management. She holds multiple leadership positions in state and national organizations and, of course, has been appointed by 2 different Tennessee government administrations to serve on state councils to address the opioid crisis. Viewers, it is an honor to be joined by Dr. Vanterpool herself. When we return, we delve into pain management and what you need to know. All this and so much more after a quick commercial break. You're watching 284 Media.
Yo, everything good, Dad?
Why? This thing got me one way, Daddy.
What do you mean?
Ever since I hook up with this thing, I can't eat, I can't sleep. This is the first thing I touch it when I reach home.
What do you really? Hey, this ain't like you,
Dad, this thing got me staying home, keeping out of trouble me.
Wow. What's your name is?
Shit, I talking about my CCT life.
Don't worry about missing your favorite series, sports, news, and local programming. Come to CCT today and sign up for CCT Live to access over 80 channels. CCT Live. Bring it home.
1 month free trial turn into 5. 5 months turn into, well, you know I huff. I watching ball. I been watching football. Dad, Nickelodeon, Paw Patrol. I am hooked. I tell you.
You viewers, welcome back. Thank you so much for sticking with us. Dr. Vanterpool, welcome to 284 Media, and most importantly, welcome home. Thank you for your time.
Thank you so much for having me.
Now, in addition to your clinical duties, you are a passionate advocate, educator, and researcher. You have developed and trademarked the targeted pain treatment method of pain management, which of course focuses on accurate diagnosis and targeted treatment of the cause of pain with a focus on function. You also direct an annual conference to educate other clinicians on how to appropriately assess and treat pain. You are regularly asked to speak at regional and national conferences to educate others on appropriate pain management, and you're currently working on a very interesting documentary that has been funded by a generous philanthropic donations to highlight the importance and impact of targeted pain treatment for patients and clinicians. I want to begin by asking you to tell us about your targeted pain treatment methods for pain management.
Well, thank you so much for asking. Pain management, or pain itself, affects so many people, so it's important to make sure that we're treating pain appropriately. Targeted pain treatment is the process of accurately diagnosing the cause or causes of pain and then targeting the treatment to the cause. And the reason why this is so important is because if patients are having the pain and their pain is not being appropriately identified or treated appropriately, that pain will continue. And when that pain continues, it causes problems down the road. It goes from their back, it affects the way they walk, and now they have pain in their knees and so on and so forth. So by identifying the cause of pain appropriately at the very beginning and then treating it in a targeted fashion, we help our patients improve their function and quality of life.
Beautiful. Now, speaking about the accurate diagnosis and really targeted treatment, I want to talk about, you mentioned particularly as it pertains to function. What should we be paying more attention to and aware of just as we go along in our daily routines? And as I mentioned in the introduction, many persons are silently suffering.
Well, if you notice, BVI landers are strong people. They want to walk, they want to work, they want to do what they want to do and enjoy life. If you've ever noticed somebody who's saying, you know, I used to be able to walk 3 miles, but my leg is hurting me so bad now I can only walk 2. Now I can only walk 1. Those are things you need to pay attention to. It may not look like it to the person that you're walking with or to your friends at work or your colleagues at work, but you know when you're not able to do the things you used to enjoy. You're not able to go on the hikes you used to be able to enjoy or walk around the park or things like that that you used to be able to do because the pain is stopping you from doing that. That's what you need to pay attention to. When those types of things stop you from doing the things you love and pain is part of what's causing that, that's when you need to see if you can do something about it.
So I want to talk about appropriately assessing and treating pain because we are so very used to, in many cases, what we call our bush medicine and wanting to treat things on our own. I want to talk about the actual appropriateness of assessing and treating pain as it pertains to here in the Virgin Islands. What are some of the things that we're going about that perhaps is not the best methods?
Well, you know, it's not so much that the remedies that people have been using for tens and hundreds of years is not the best methods necessarily. But what we want to do is we want to make sure we've identified the cause of pain as precisely as possible. So the way that I go about doing that, and the way that any clinician can theoretically go about doing that, is by really paying attention to and listening to the patient first and foremost. Starting with a very good history, having you come in and tell me what's going on, when the pain started, what it felt like. And then once I have that information, doing a thorough physical exam, examining the patient and figuring out what body parts or anatomic structures might be contributing to your pain or loss of function. And then finally, for me, using my clinical and specialist knowledge with over 12 years of experience practicing as a pain specialist, I can put all of those pieces together and identify the physiologic, anatomic, functional, and even the psychosocial components that are causing your particular pain complaint. And then once we've done that, then we can target the treatment.
Understood. Now, speaking of such, can you tell us about your services at Bougainvillea that you have been conducting in pain management since 2021?
Yes, I'm so proud to be able to come back and serve the people of the BVI with this service. So the services we provide at Bougainvillea Clinic include all of the services, or the vast majority of services, that I'm able to even provide in the United States. So instead of you having to come to visit me or visit a specialist in Puerto Rico or Miami, we're able to do advanced procedures right here in the BVI. It starts off with that specialized consultation that I mentioned, but then we're able to offer ultrasound-guided targeted injections, fluoroscopic, that's X-ray guided injections, advanced procedures such as cauterizing or burning of nerves that might be causing chronic pain. We have all of that capability right here in the British Virgin Islands.
Beautiful. I want to talk about the costs to patients because this is, of course, a very needed service. But as it stands, coverage for clinical services and cases are not covered by NHI. Tell us about that, and perhaps how are we going to possibly work through that?
So the NHI has determined that, or has not yet completed their due diligence. These are their words. They have not yet completed their due diligence on whether or not this service is needed for the people of the BVI and how they're going to decide whether or not they're going to pay for it. They've given some examples of some things that are required to complete this due diligence, but in my estimation, this is a service that is well established throughout the United States, and it's very much needed here in the British Virgin Islands. Indeed, we have patients who have taken their own money and traveled to St. Thomas and Puerto Rico and the United States to have procedures, surgeries, etc. So to actually limit the people of the BVI's access to this service here in the British Virgin Islands when you have a specialist that's coming down to offer it here locally seems very counterproductive to the mission of what I understand the NHI to provide, which is to provide the health care that is needed for the people of the BVI in the BVI.
Now, as a result of that, what is the average cost for patients who are in need of this service?
So the cost depends on the cause of the pain and the nature of the procedures or services required. So for example, a patient will come in and they'll have a consultation. The consultation is a standard consultation, an advanced consultation, but in terms of consultations that can be done elsewhere on the British Virgin Islands, the same type of consultation fee. The NHI, I believe, is covering the consultation, but then when it comes to the actual procedures, the cost varies depending on the procedure that's required. Some procedures are more straightforward than others. Some do not require specialized equipment such as ultrasound or fluoroscopy. Others require a combination of specialized equipment, so the cost will increase depending on nature of the procedure and the specialized equipment required. If a patient comes to me and sees me and we determine that a particular procedure is needed, we can determine the cost based on established codes that are established throughout the country, but the cost is then unfortunately relayed to the patient because NHI has not yet decided that they are going to cover the services.
Understood. Thank you so much for sharing. One of the things, Dr. Vanterpool, that I must touch on is something that we are not too familiar with here in the Virgin Islands. However, internationally, there is an opioid situation, and a lot of this comes from situations like pain management. Persons are using medication such as opioids that would help to help them with the pain, but then it then becomes an addiction. You have done a tremendous amount of work in trying to curb that opioid situation. Tell us about the balance between effective pain treatment versus persons and prescription medication, and then of course touch on the situation that many of us might not be too aware of as it pertains to the opioid situation and addiction that comes from consistent usage.
So the opioid epidemic has been rampant in the United States for several years, and it has several causes, including illicit medications coming into the country, but a lot of it started from mismanagement of pain. So when it came to mismanaging pain, what I mean by that is patients would show up with, say, a sprained wrist or something that's an inflammatory pain that we would normally take ibuprofen for, and they would be given a medication, a narcotic or an opioid, that would dull the pain. But the problem with dulling the pain without treating the cause of pain is similar to putting a Band-Aid over a bleeding wound before you stop the bleeding. After a time, it bleeds through that Band-Aid, and you need a bigger Band-Aid and a bigger Band-Aid and a bigger Band-Aid until you're soaked, even though because you're still bleeding. So when you don't treat the cause of pain and you cover it up with an opioid instead of actually treating the source of pain, your body becomes tolerant to that medication. It no longer works as well. So now you need more medicine and more medicine and more medicine. And then that can bring you to a point where you become physically dependent on the medicine. You can't go without it. Or some patients would become addicted to the medicine. Now they start seeking it for things that are not pain related because they're chemically or mentally or psychologically addicted to the medicine. And so by treating the cause of pain for those patients who might have been given an opioid at the beginning instead of the appropriate treatment, we're able to prevent that vicious cycle of escalating doses of narcotic or opioid medications that can lead to tolerance, dependence, and addiction. And that's why targeted pain treatment is so important.
Where would you say we are on an international level in curbing the opioid situation?
You know, in the patients that I have seen, there are very few that are even on any type of opioid at all. In the British Virgin Islands, from what I have seen of the patients that have come to see me, there's not a common prescribing pattern amongst other clinicians in the BVI to prescribe opioid medications for pain. A lot of patients are on NSAIDs or anti-inflammatory medications, which can help certain types of pain and can help it very well. The challenge with anti-inflammatory medications, though, is that if you take too much of them, they can affect your kidneys. So it's still not just that opioids are the only medication that are good, bad, or indifferent. There's truly no bad medication. It's about how you use it and how you apply it to the underlying cause. If you take too many opioid medications, you can become dependent and addicted. If you take too many NSAIDs or anti-inflammatory medications, you can end up with gastric problems, stomach ulcers, kidney problems, and so on. So we've got to be cautious and balanced in how we use these medications.
Understood. Now, one of the things you mentioned earlier is that Virgin Islanders are hardworking people. We can attest to that. They love to engage, work, exercise, earn a living, and we need to essentially get back to a place where persons are happy in doing what they love, because again, the pain situation and suffering from different elements of pain have caused many persons to not be able to do that. Through your services, I want to talk about some of the success stories that you have seen, particularly in the BVI, where persons perhaps were not able to do the things that they have always done for such a long time, in getting them back to that place.
Sure. So I am grateful and blessed, first of all, that I have been able to provide this service here for a year. So I've been able to see some of my patients come back just to follow up with me. One I saw this trip was had some back pain that was preventing him from lifting a leg and being able to do the activities he wanted to do. And now he's able to move that leg and no longer using crutches. So he's improving. He's not all the way better, but he's improving. I've got another patient who was unable to be as physically active as he wanted to be, unable to play his sports. And now that we've done the procedure, the targeted injection, he's playing his sports every single morning. I've had other patients who have come in with headaches that have been debilitating for years, and we do a specialized procedure to treat their headache, and their headaches have been resolved for months at a time.
Beautiful.
So it's all about me identifying the cause of pain as precisely as possible and then treating the cause. The important thing to note, though, is that there are tools available to help other clinicians here on island be better diagnosticians or better able to accurately diagnose the cause of pain also.
Okay.
I provide a service, you mentioned in the introduction, I do an annual targeted pain treatment conference where we educate other clinicians on how to diagnose and treat pain. But in addition, there's a toolkit at www.tpt-toolkit.com that clinicians can download for free that gives them tips and tools and evidence-based methods so that they can start the process of diagnosing the cause of pain. This will help the patients with the BVI because that means when I come down, we already have started the work. And so when I come down, we can be more efficient in treating the cause.
Absolutely amazing. Again, I want to commend you for your time and for bringing the service back to the Virgin Islands. You mentioned about identifying the source of pain, which in my opinion, based on the conversation, is essentially giving Virgin Islanders hope. Am I correct?
Correct. So when patients are coming to see me and they've had pain for years and it's stopping them from doing what they want to do and they don't know why they hurt, it can mess with your mind. It can mess with your ability to, you think something's wrong with you. So when I'm able to look at a patient, examine them, look at their MRI imaging and tell them this is where your pain is coming from and this is how we can treat it, you can see the relief in their face. You can see, even though they still have the pain, they now have hope that there's an outcome that they can live with, that they can get back to doing the things they love. And that's part of why targeted pain treatment is so valuable for our people of the BVI.
Dr. Vanterpool, I want to thank you once again for not only your specialized pain management treatment, but like we just talked about, bringing hope back to Virgin Islanders and of course your patients on the international scene as it pertains to effectively not only assessing but treating pain management. We do know that you are at Bougainvillea Clinic, but before you go, I want you to speak to the Virgin Islands community for persons who may be interested in the service in regards to getting in contact with the clinic and perhaps being able to schedule a consultation with yourself.
Thank you. So to schedule a consultation with me, you can contact Bougainvillea Clinic and ask to be put on my schedule. They'll ask you some questions about your pain and ask for some documentation. This is just so that we can efficiently assess and treat your pain when I get down to the Virgin Islands. I come down approximately every 3 to 4 months. I'm trying to make it every 2 to 3 months at this time. And when I come down, I like to see my patients, evaluate them, and then determine the procedures or treatments that you might need. Very important to note, not every patient needs a procedure. Some patients may need physical therapy or specialized medications, and so we're able to provide all of those services through our consultations at the Bougainvillea Clinic. Contact us and ask for Dr. Stephanie Vanterpool for pain management, and they'll get you on my schedule.
Once again, we were joined by a pain specialist herself, Dr. Stephanie Vanterpool, of course, treating pain, but bringing hope back to the lives of Virgin Islanders. Viewers, I want to thank you so much for tuning in. We'll see you a bit later. Bye-bye.